Hello class, for today's discussion, I'm going to be going over the musculoskeletal assessment. So, starting with subjective assessment, we're going to be asking questions about joints, muscles, bone, and ADLs, activities of daily living. So, you're going to start off by asking if there's any problems associated with the joints, any pain in any of the joints. And then if there is any pain, you're going to be asking about the location of that pain, the quality of the pain, the severity of the pain, when it started, when it occurs throughout the day, what happened, what the individual is doing whenever they're experiencing that pain, what makes it better or worse. And then you'll move on to ask if there's any stiffness in the joints, any redness, heat, or swelling. And then you're going to want to ask if there's any joint limitation. So is there any limitation in the mobility of a specific joint or that joint? Moving on to the muscles, you're going to be asking about pain as well, going over those same topics: quality, severity, onset, timing, and what makes it better or worse. Specifically with muscles, you're going to be asking whether or not they have been experiencing cramping, and if there is cramping, is it in the calves? Because if it's in the calves and it's occurring during walking, it could be a sign of vascular disease. Also with muscles, you're going to want to ask about any weakness in any muscle group, and then the location, obviously, of that muscle group, specifically narrowing it down to a certain area. Then moving on to the bone, you're going to ask if there's any deformities in the bone, if there is any numbness or tingling in any areas, and then if there has been any recent accidents or trauma. If there has been trauma, you're going to ask when it occurred, and then what treatments were done following the trauma. You might also want to ask if the treatment was effective. And then moving from all of those topics, we covered joints, muscles, bone, you're going to want to ask about ADLs. If there has been any problems in any areas, you're going to want to know if those problems affect ADLs. And when we talk about activities of daily living, specifically, we want to focus on bathing, toileting, dressing, grooming, eating, communicating, and mobility. So whether or not those problems affect any of those categories. And then specifically for the adolescent, we're going to ask questions about physical activity in school and outside of school. So with that, we're going to ask about sports, if they're involved in any sports in school or after school sports. And then you're going to ask if there's any physical training regimens associated with that. And you're going to ask what happens if they do get hurt. What do they do if they get hurt? And that is going to cover the subjective assessment. Moving on to the physical assessment, we're going to go from a head to toe. Point of view. So starting with the temporomandibular joint, what you're going to want to do is inspect anterior to the ears, and you're going to see on both sides. You're going to palpate right here, right in front of the ears. You're going to ask the patient to bring their jaw down, and then you're going to feel those muscles in the jaw, and then you're going to ask the patient to move the jaw forward, and then laterally to each side, and then you're going to ask them to clench down and really feel those muscles. There shouldn't be any tenderness in these muscles. All right. And then normal assessment values for that would be 3 to 6 centimeters between the incisors. So each teeth, whenever they open their mouth as far as they can, you're going to be able to feel about 3 to 6 centimeters of a gap. And then whenever they move their jaw laterally, you're going to be looking for about 1 to 2 centimeters of movement in that. And then when they protrude their mouth, their lower jaw forward, you're going to be looking to see if there's any deviation. No deviation is expected, so in this case it's all normal. And then moving on to the spine, so the cervical spine. What you're going to be looking for with the cervical spine is head and neck alignment. So looking at both shoulders, the head shouldn't be tilted one way or the other. Then you're going to go on to palpate. So you're going to palpate these muscles. We're going to palpate trapezius muscles in the scapula. There shouldn't be any tenderness, any nodules. There shouldn't be any of that. Nothing should be soft. Then you're going to feel the spine itself. It should be midline. There should be no tenderness on these processes. Then moving on to range of motion, what you're going to do is ask your patient to move tilt their head up to the ceiling, and that should be a 55-degree angle. They should be able to move their head back, hyperextend it back 55 degrees. Then you're going to ask them to move their chin to their chest. They should be able to do that to 45 degrees. Then you're going to have them move their ear to their shoulder, and they should be able to go about 40 degrees both ways with that. And then you're going to have them move their chin to their shoulder, to either side, and they should be able to go about 70 degrees both ways. Next, we're going to go on to the assessment of the shoulders. So you should have a even on both sides, even height. When you inspect the shoulder, you're going to be looking at the contour of the shoulders, and we're also going to be looking at the skin color. For this case, I'll be feeling if the contour with palpation, since the client or patient has their shirt on still. But whenever they have a gown on, if the gown's already been uncovered, you can see that. And then you can also palpate and feel the symmetry. So you're going to start by palpating the clavicles all the way to the acromion, where the clavicles and the acromion meet. The bones and muscles in this